What's going on, guys? Dr. Natty here from Myokinetic Physical Therapy and Performance. And today, I am going to help you open up your hips and get some hip mobility so that way you don't have that back tightness when you're working out, deadlifting, squatting, that pinching sensation. So these are something that I would do personally when I feel this kind of achy, pinching pain in the front of my hip, especially when I'm running, squatting, lifting, right? So let's get right into it. All right, so the first thing, if you were to walk into my clinic, I would tell you that you need something like a foam roller or a ball. These guys are awesome because they are vibrated, so that way you can actually warm up your tissue as you're rolling out at the same time. So it's like a double whammy. So the reason why I want to do this first is that the hips is actually has so many muscle around it. So if some of the muscle is actually tight and it's pulling, you're gonna lose this motion that you have that can go front and back, right? So what we wanna do, we wanna address those soft tissue that actually stopping you from going and get the range of motion that you would like to have, especially when it comes to squatting. So the first thing we're gonna do, we're gonna address the front of the hip, which is your hip flexor, your quads, and your TFL. So let me turn this guys on. So from there, what I'm gonna do first is, I'm gonna get right into the top of my quad and my TFL, which is a small muscle right here. And bonus point, if you guys are having that IT band syndrome or IT band tightness, rolling this out is not gonna help. What you really wanna do is get into that TFL right there. So let me show you how to get there. So you find your front pocket, there's a little muscle right there. You're just gonna lay on top of that, just like that, okay? So I'm gonna show on my left side. So I'm gonna lay on top, and it's a small muscle, so you wanna go up and down. Notice how I use my arms to help me, and even this leg as well. So I'm going up and down till I find something that's tender. So I find that right there. I'm gonna hold that there, and I'm gonna rock back and forth. And I will do this 10 to 15 times until I feel it kind of loosen up a little bit. And it's gonna feel kind of junky in the beginning. And the more you do it, the more better you're gonna feel. So it is a couple times. Now, after I do this for about 10 to 15 reps, I would then move forward right into my hip flexor and the top of my quads, because it's such an easy transition. Because all I have to do is just roll all the way forward. Now I'm gonna get my elbows on top, like a little army crawl. I will use this leg to help me, and from there I'm just gonna go up and down. Right in front of the hips. Again, if you sit a lot at work, in school, you're gonna wanna do this because your hip flexor is gonna be shortened in that sitting position. If one of your muscles pulling forward, it's gonna cause the other muscle in the back to actually lengthen. So that's why your hips feel so tight. So same thing, 10 to 15. Get the hip flexors, and then from there, we're gonna keep army crawling our way up to go get the quads. So from there, you see I'm just gonna go up and down. There you go. So we're opening everything up in the front. Same thing, 10 to 15. Again, if you're having knee pain too, opening up the quads and the hip flexor will help. All right, so that's what we got for the front of the hip. Now let's address the back of the hip. All right, guys, now we're gonna use a ball. You can use softball, lacrosse ball. I like this one because, like the foam roller, it vibrated. So from there, you can actually warm up your muscle at the same time. So from here, we're gonna address the back of the hips, which is your glutes, your piriformis, all the hips external rotators. So that way you can open up the hips so you can actually have that range of motion you're looking for. All right, so what we're gonna do is we're gonna address the glute med, which is the side of your hips right here. So you have your glute med, your glute max. So we're gonna go the side first. So we're working our way outside in, okay? All you're gonna do is place the ball right on here, outside, on almost pretty much on the outside of your back pocket, right? Then from there, I'm gonna slowly shift my weight. You guys see how I slowly shift and I put my weight on there. I put my hands here as well, right? So from there, I'm gonna slowly move side to side till I find a good tender spot, and that's the spot for me right there. So it's like right by your tailbone, your sacrum. Once I find that spot, I'm gonna hold that there, and all I'm gonna do is I'm just gonna drop my left knee down to the ground. And from there, it's gonna slowly release that muscle. I will do 15 reps on this one because there's a lot of muscles there. There's the deep 8 muscles that actually help, rotate the hips, both internal and external. So we wanna get all those guys right there, and your glute meds. So we get the glute meds right there, 10 to 15 reps. Then all we're gonna do is we're gonna keep slowly move inward. So now I'm going inner, right? So that's deeper. it's gonna be a little more tender, so you're gonna use your arms a little bit more. If this is too much, use a foam roller. Same thing, up and down, 10 to 15 times. Now, if you want the advanced one and you really want to feel your hips, all you can do is bring this one leg up. So you see now I expose my hips even more, and then from there I'm just gonna move up and down. And I'm just gonna hold that right there. And we can hold it for 10 to 30 seconds. There you go, use your legs to help you. All right, and we're gonna do this on both sides, okay? Same thing, get this here. Again, on the outside first, find a good spot, drop down. Oh, yep, there you go. I did legs a couple days ago, so now I'm really feeling it. And I'm gonna work my way inner to get more of that deep hip external and internal rotators. Drop that down more. And if I want to really go deeper, I will cross, and I'm just gonna go up and down. Do that on both sides, front and back. Awesome. All right, now that you feel really good by just rolling out the front of the hips, the back of the hips, next thing we're gonna do, we're actually gonna get the joint itself to start moving better, right? Because you wanna have space so that way you can squat with no pain, right? So all we're gonna do this banded mobilization. I got 3 things for you guys, so let's go over the first one. So the first thing, you wanna have a nice band with good tension so that we can actually help pull your joint. And we're gonna go with that pigeon stretch, right? So from here, you see how I bring the band as close to my groin as possible. And from here, I'm gonna go into a nice modified pigeon. Notice, I want the band to be 45 degrees. So we're not going this way, we're going this way. So now the hips is being pulled backward a little bit. And I get here, right? I'm gonna stay nice and relaxed so the band's pulling my hips back. So you see how my hips sink in a little bit more? All I'm gonna do, I will use the band to my advantage as I move with the band. So what I mean by is I'm gonna move by reaching. As I reach, my hips sink back and the band pulling it out more. Should feel really good after a long day of sitting in work or at school. And then from there, I'm gonna slowly rotate back up. And I like to do this minimum 10 reps. Rotate, reach. If you don't feel the pulling, that means you're not relaxing enough or the band is too light. And I like to do all 3 of these in one hips, and then we'll move on to the next one. All right, so now that we got the hips to move in 45 degrees, now we're gonna get it to move back because it's a ball and socket joint. So we want all range of motion. So from here, we're gonna bring the band up towards the hip. This way, you guys are gonna go back down into that pigeon pose again. And now the band's gonna pull directly back. And same thing, this one, you're just gonna lay down, you're gonna shift your hip back here, come back. Shift your hip back here, come back. And I would just do that 10 times. And again, you should feel a nice stretch on this one. If it's pinchy, make sure you move the band down a little bit lower, okay? So I'm just gonna shift and I'm gonna hold, come back, 10 to 15 times. Awesome. All right, so next one, we're actually gonna open up the front of the hips, get the hips to move a little bit. It's a really nice hip flexor mobilization here, okay? So we're gonna go get the band right underneath your butt. And you're gonna have a little pad behind you so that way you can come down. You're gonna kneel down right here. And you're gonna see that the band's gonna pull my hips forward. And that's what we want, right? Especially if you're sitting all day. See how your hip flexors kind of bunch up? All we're trying to do is just open everything up, especially right after we just foam roll. So you're gonna let this band pull you forward, stay nice and relaxed. One common mistake is that you want to arch your back. And I don't want that, okay? I want you to keep your core tight, keep your lower back flat, and just let the band pull you forward. And you're gonna feel much better stretch when you do that. We're gonna hold this for 10 seconds. And we're gonna come back. And I like to do this 5 to 10 times, depending on how tight you feel. And the best way to test this is to do a couple squats before and then do it after. Good. Now, a pro tip, if you can maintain good core stability when you're doing this, you can add in a little rotation. So now you get more hip flexion. Get more of that stretch. Come back. Maintain. Don't arch your back. Rotate. All right, so now that we did our foam rolling, our hip mobilization, now we're gonna go to activation. And this is probably the most common exercise I see on the internet. on social media. Everyone's doing it, right? Which is the band walk. But most of the time when I see my patient and when they do it on their own, they don't feel the hips, they actually feel the back, which means you're doing it wrong. So here's an easy fix, right? So you can place the band above knee or below the knee. So the higher it is, the easier it is. The lower it goes, the harder it is. I like to go right below the knees. When you're here, the best thing you want to do first, because we're activating your hips, is you want to load the hips. And how do you do that? You want to make sure you stick your butt back first. That's how you load and that's how you hip hinge, right? So I always pretend like I'm about to go for a nice deadlift, right? So I load the hips. So you should feel all the tension in your hamstring, your hips. Second thing I'm checking for is that making sure that the bands are not pulling my knees in. So if you're using like a slingshot, something that's really heavy resistant, that's gonna be too much for you, right? So we use a nice light band so that way you can keep your knee at neutral, right? So you want the knee to be over your second, your third toe, right? So we're loading the hips, the knee's in good spot, the band has good tension, and all we're gonna do is we're gonna push. So what I mean by that is if I wanna go left, I'm pushing with my right. And what I see when people do this and they do it wrong is that they don't push, they think about reaching, right? So we wanna push. So if I'm gonna push, I'm gonna make sure I load this hip and I'm pushing into the ground to go here. And I'm gonna come right back to where I start. I don't wanna bring it too close, okay? So I'm gonna push, come right back. I'm gonna push, come right back. Now, if I see you do this, when you're leaning over and then you push, that means the band's too strong. So you wanna maintain neutral position, load the hip, push, push, push. And if I'm going back this way, guess what? I will push with my left to go to the right. So this is the opposite the whole time. And this whole time, I always put my hands on my back pocket here to make sure I feel the glutes contracting each time I push. And if you start feeling tired on your lower back, that means you're extending your back too much. So you want to relax your back and keep pushing with your hips. Now, as far as reps and set, I like to go 8 to 15, right? Because if you do it right, you get fatigued extremely fast. All right, so this one is an advanced one compared to the band walk because it's really, really hard. It's challenging your single leg stability, but it's gonna help you really load your hips, right? So we're calling this the fire hydrant. So all you're gonna do, you're gonna stand against the wall so you have good balance. So you have two options. You can keep it here, which is easier, or you can bring it up here to challenge yourself a little bit more. But the biggest thing that when I see people do this, I wanna make sure you really get your butt back, right? And you're not extending your back. So you're gonna come in. I like to weight shift first, load my glutes. So all the right leg, all the way to there. Then I bring my leg up here, right? Notice my knee still over my second or third toe. I'm loading my hips. So all we're gonna do is this leg is gonna go out, and as it's going out, it's gonna pull this band. And the band's gonna pull your knees in. Your job is to keep it exactly where it is. So you resist the pulling, so you resist this. You can feel this muscle's working. And you come back in nice and slow. So out, resist, come back in. If you do this wrong, the knee's gonna go in, right? Your job is not to let it go in. And you're gonna load the hips, nice and slow in this tempo. And we're gonna do this, again, 8 to 15 reps. If you were a golfer, anything that's rotation, baseball, hockey, all my rotation athletes out there, this is great for you because you wanna load your hips here. And right now, I got really fatigued, then I'm gonna stop. And then from there, I'm gonna switch to the other side, shift my weight here, get this here, load my hips, relax my back, fight the resistance, control. Again, we're looking for 8 to 15, nice and slow. So 6 reps in, I'm already feeling it. I'm shaking already, guys. So if you do this correctly, it's gonna challenge you. All right, guys, so that's it for our hip mobility video. So I hope you guys really enjoy that and you get a good workout going forward with no hip pinching, no cramping, nothing like that. And you actually feel really good when you're doing your squat, your deadlift. If you like this video, like and subscribe, and I'll see you next time.